Hi, my name is Dr. Hamilton, and today I'm going to be going over with you how to do a proper psoas stretch. Now, the psoas is a very big muscle that actually is responsible for hip flexion. The problem is that when the majority of us sit for an extended period of time, what this muscle does is it ends up shortening. So if you end up sitting for over 4 to 5 hours a day, what ends up happening is this will continue to shorten, and with time as that shortens, when you walk it will actually cause the pelvis to tilt forward. This anterior pelvic tilt can actually cause jamming of the facet vertebrae in the back or the joints and cause irritation or inflammation there. So what we want to do is anytime that you have back pain, we always want to assess what's going on with the psoas and see if that's a contributing factor. The key stretch with the psoas is what you end up wanting to do is you're going to be more in a lunge position. In the lunge position, what you're going to end up doing is actually bringing the foot back, not at a 45-degree angle, but about 15 degrees here. You're going to keep the torso nice and erect here. You're going to lean forward, allowing the stretch right here in the front. The heel is going to come up off of the back because if you leave the heel planted, it becomes more of a calf or a gastrocnemius stretch. So you're going to lean forward right here, take a deep breath in, and breathe out and sink down a little bit deeper, sitting deeper into this, allowing that stretch to come. What ends up happening is if the knee starts going past the tips of the toes, you need to take a step further out because if the knees go past the tips of the toes, it increases the shearing forces on the knee joint, which can cause knee issues. So you're going to go again, take a deep breath in, chest out, and sink deeper into this. You can repeat this as many times as you want, but make sure you consult a licensed physician to see if the psoas is imbalanced only on one side or if it's something where we want to stretch it on both sides. Pay attention to how this is feeling and how you're actually leaning, because if you're leaning too far forward, you're not going to get the same stretch as if you keep that chest out and proud. Making sure to stretch out the psoas will help allow things to move properly in the pelvic and the lumbar area to avoid any type of irritation or inflammation with that back pain.